Yeah. Karolina can hear us great. Welcome to today's Tuesday topic. This is PhD student homecoming. Some alumni talking about developing their dissertation. We've got a panel here in the room. Bob Palisano is the moderator, and we've got some great alumni online who will share their great insights. If you are on the back table when you came in, don't forget to pick up a survey so that we get a sense of how valuable you guys found this to be. As well as I've listed some posters of some of the upcoming Tuesday topics, and a cool little feature I want to draw your eye to is if you aim your smartphone camera at the little thing in the corner, it'll prompt you to be able to see all the Tuesday topics for the entire term, and you can register right away. So just aim your camera there and you're good to go. All right, so Bob Palisano, take it away.
Well, welcome everyone. I like this chair. I feel like a reality show host. And we're really fortunate and lucky. We've really, it's been exciting to watch graduates of the PhD program as they move on. And about last spring, PhD program director said, geez, it would really be nice to hear from them after they've sort of had a chance to at least reflect. And many of, they'll tell you they're in the next phases of their careers. So one of the things, and I talked about, is if I knew then what I knew now, and I think in some regards, the PhD in the dissertation process, there's always looking back. It gives you a chance to reflect, and I think there's a lot of lived experiences. So what I'll just do is give you the name, let everyone introduce themselves, and then just tell people a little bit about your dissertation topic and what you're up to these days. And then it's really meant to be a pretty open discussion and so encourage people to ask those questions you'd really like, because you'll get a different perspective and a very valuable one from recent graduates. So Min-Young Chim.
Hi, my name is Min-Young Chim. I'm currently assistant research professor in the Department of Creative Arts Therapies. I'm also a dance movement therapist, and I graduated 2015 in the PhD program in the Creative Arts Therapies here.
She's got to tell him you got a big grant. You can tell him that. Tell him what your career project. Yeah.
So upon graduation, I did my postdoc at Stony Brook University, where I actually was able to get training in grant writing after several trials of submitting grants. And right after I got my job here, I learned that I am getting this NIH grant, R34 grant, that will support me to conduct this 3-year project to look at the feasibility and acceptability of dance movement therapy intervention for chronic pain management. So we have just finished the first year of the 3-year project, and yeah, I have 6 other collaborators within the college as well as Stony Brook University.
Hi, I'm Jacelyn Biondo. I am a recent 2019 grad from the Creative Arts Therapy Department, also dance therapist. Currently, I'm working as a postdoctoral research fellow, primarily with Dr. Yoka Brat, and then supplementally with Dr. Garija Kaimal. And my research for my dissertation was the effects of a single session dance movement therapy intervention on thought and behavioral dysfunction for people with acute schizophrenia in an inpatient psychiatric facility, mixed methods feasibility study. And I'm also currently getting ready to submit a small grant for another research project that I'm working on.
Hello, everybody. My name is Rebecca Diederich Hartwell. I am also a dance movement therapist. We have all these dance movement therapists here. And I also graduated last year in 2019. And my dissertation was a qualitative research study, and I looked at just the experiences of refugees in Philadelphia, and also kind of wanted to see how movement and creative dance and body awareness can be a resource for them. I am currently working as a postdoctoral research fellow with Dr. Garija Kaimal. She's an art therapist. And so we are doing collaborations with dance movement therapy and art therapy and other departments at Drexel. And also lots of studies with veterans. And so we have some grants from the DOD. We're currently also applying for an NIH grant. So looking how that goes. I think that's all.
Trey?
Just unmute my computer there. Hey guys, my name's Trey Brindle. I graduated in 2017 and my dissertation was on the biomechanics and physiological factors in female runners associated with a single discrete variable, the peak hip abduction angle in those runners. It feels like such a long time ago. I had to look up the files real quick to see what my dissertation title was. But since then, I moved from Philly to Burlington, North Carolina, where I was a postdoc for a year and a half at High Point University there with Dr. Kevin Ford. And so I continued working on running biomechanics there. And then shortly, like afterwards, right away, I got a position at West Point where I'm working. It's kind of complicated. I'm at West Point. I'm working in the Baylor Keller Army Community Hospital Fellowship for physical therapists in the military. They come here for a year and a half to study, learn new techniques in treatment and also research. And they attain their doctorate of science from Baylor University. And I'm an assistant professor for that program and also a research scientist for the Geneva Foundation, mostly working on grant writing and study management, new study development, that sort of thing.
Kendra?
Hi. I don't remember my dissertation topic either. I'm so happy I'm not the only one. I remember, I can tell you a little bit about it. I graduated in 2017 also. It doesn't seem like that long ago to me. But I am up to a lot of things now. And I'm the dementia program director in Brooklyn, New York at a nursing home. And here I do a lot of grant writing and I supervise 4 creative arts therapists and 2 certified nursing assistants. And I'm also the assistant research professor at NYU, or do some research there in the Department of Rehabilitation Medicine. And I'm doing some part-time work at Montclair University and some contract work at NYU's Alzheimer's Disease Centers. And I am also working on a grant that I got from the Alzheimer's Association. It's a minority fellowship. So just to go back to my dissertation, it was a mixed method study to look at music-based activities for people with HIV-associated neurological disorders who also had depressive symptoms. So that's what I'm up to in a nutshell.
Abby?
Hi, I know most of you. I am a postdoctoral fellow right now at Drexel in the SNAP education grant, which is on the first floor. And we work with the SNAP Ed to assess how education in schools and rec centers, how that's going. My dissertation was evaluating the effects of a multi-component school-based intervention on the health behaviors and health outcomes of children. And both my dissertation and my postdoc are with Stella Volpe, who's in the nutrition department. I'm also at home. I'm on maternity leave, so I just had a baby about a month and a half ago. And here I am.
Congratulations.
Thank you. Maybe he'll make his
Carol-
appearance at some point.
It is part of the life balance, right?
Yeah, there's something there.
Looks like, yeah. Although it's probably shifted to one side, huh? with
Yeah,
the
it's a
new
little bit life.
in
not so
another
much
young
work
child, yeah.
right now. Though I am doing things like this, so balancing.
Karolina?
Hi, I'm also a grad from the program of Creative Arts Therapies at Drexel. I graduated in 2018, and similarly to Kendra and Trey, I had to look up the title. I was researching the role of dance movement therapy in treatment of negative symptom and psychosocial functioning in chronic schizophrenia. Was also a mixed method study. Right now, I'm on my second year of postdoctoral fellowship at Drexel. I'm working primarily with Dr. Yoka Brad on coordinating being a site research coordinator for pain management support study and for advanced cancer patients as well as for cancer survivors. And I also work with Dean Gitlin. I'm helping her with multiple tasks related to her grants on dementia study. And I'm at this point that I'm actively searching and looking and submitting my resume to other places. So I'm starting to be in this little transition place.
Great. So we, folks here, I think you all range from earlier in your doctoral to some doctoral candidates. And please, it's meant to be a free discussion. So please ask questions that you might be thinking about, almost reflecting on where you're at and some of the things. And you all too could, I think it's on like, what are the things you'd like to share that you think you've learned that might be most useful? And if people want to just start, one of the things that I shared, really, at least where I've personally seen and you've all experienced, is how do you progress from you come in, you may have an advisor, you may have a research area, and then you have to land on a more specific aim. So I don't know, but don't limit, but if people would like to share some of your experiences that you think would be really useful for them to know, and I know you all have a lot of them.
I don't know where you are in terms of your PhD journey, but if you're really in the stage where you're thinking about deciding on the topic, I think based on my experience, what was helpful was that I started my program maybe with like 3 different topics that I was interested in. It was, when you don't know what exactly you want, what helps you is the illumination, that what throughout the course, really illuminating that something that is getting to the topic that you are really passionate about and curious about, and also the balance between really knowing the gap in the literature in your field and what you can really contribute. But for me, it was really more like an elimination process of what I cannot live with for the the next few years, and what I'm most passionate about. And the practical things I would want to recommend is I found some of my favorite writers or researchers, and really reading their reference list of the articles. That really helped me to, when I was reading the reference list, like some of the words would just pop up, and I was able to formulate some of the research questions that I would like to ask myself. So that was one way that I've used and found helpful, kind of narrowing down the research topic. So that's what I can share.
I can add that when I came in, I knew exactly what I wanted to do. I knew exactly what my research was going to be. I knew everything about it. And that was way too much to actually fit into a doctoral dissertation. And so you have to be really mindful about how much is feasible to do. And really, once you have a committee, they are the experts. They will be able to tell you that you're not going to be able to do something And you really need to reach out to them and discuss your ideas with them really thoroughly, because they will help you weed things out. And then I also had to separate what I felt emotionally drawn to do and emotionally connected to with my research versus what was actually needed and where to start. I think sometimes I have been practicing as a clinician the whole way through my dissertation. And so I was taking my clinical knowledge to see what the gaps were and where I needed to do research. And so I had to really kind of tease out what's the basic that you can do, because I think we all have these grand ideas, which is why we came into a PhD program, but they're not necessarily even needed yet. And we have to really be okay and kind of tame the ego to say, I'm really going to do some basic research here because that's what's lacking, and be okay with that, and not let your emotions of what you were drawn to do because of your passion get in the way of that. And I found that I constantly had to look at my research proposal and say, am I doing this out of necessity or out of a gap or out of the data, or am I doing this because I really feel strongly connected to it emotionally? And if you can try and tease those apart, that will also narrow down your topic.
I agree with everything that was said. Maybe just really just reiterating though, the keeping it manageable. I think that was sort of what I came back to again and again, because again, similarly, I had these really grandiose ideas and really wanted to change the world, but then realized that that's not going to be possible or necessary. You know, it's really about just filling one little piece in what we don't know and making it manageable. This is not going to be your life project. There will be other projects after. This is really about also getting it done. And mine ended up being much, much longer than I wanted it to be and was hoping for. But that was, I think there will be more time to speak to that. But really thinking about what makes sense, you know, what can I do in the time that I want to spend on this?
I'll contribute. My path was a little different. I didn't really come in knowing which project I wanted to do or what my focus was. I started as a project manager working on a study that was already in existence. So my interests kind of evolved based on what I was already working on. And with that, I was able to start thinking about what ideas needed more research moving forward. So that's been helpful to kind of direct my path moving forward of what my research interests are. So a little bit backwards, or not backwards, just a little different than a lot of traditional PhD students. And with that, I've also, as many people also have been doing, are managing life and work and the PhD on top of that. This is now my second child, so kind of having bumps along the way has been challenging, but also doable, and kind of a learning curve of how to get it all done in a timely fashion, if that's possible.
I'll add another piece. Definitely the interest of the person in the topic is important. I would say start as early as possible in picking an idea and exploring that idea. I worked with Dr. Claire Milner at Drexel in the Rehabilitation Science program. And one thing we learned in just our preliminary projects was we had an interest in patellofemoral or plantar fasciitis. But in exploring that topic, trying to find the participants who would be eligible for a study like that around our area, we were very limited in that. And then also exploring, you know, the limitations you have in your measurement as well with your idea early on, so that you know if the techniques that you plan on doing in your dissertation can overcome those limitations.
I think I have just a little bit of a different spin on that. Can you hear me?
Yes.
I was thinking about it last night, and just reflecting, I ended up rewriting my introduction section at least 2 times because I realized that, you know, my interest was dementia, but the focus was not necessarily on dementia. It was on the people who I was working with. So I had to realize that, you know, I'm looking at the depression symptoms versus what, you know, my initial passion has in work life has been in dementia. So I think don't be afraid to start over. Don't be afraid to take that, you know, feedback from your advisor or your committee members, because I think as you start to write, your ideas will develop, and it's okay if you know, if you have to start over.
Karolina, did you have anything you might add?
I agree with what everyone else said, basically. I think what was the most important for me was the moment when I, with the help of my advisor, I was able to narrow down the topic. I think that was happening for me the most, that I wanted to do so much, and I had so many ideas and so many ways to approach the problem. And narrowing it down, making it really feasible for me, but also for resources that I had, that was very helpful. And then this really moved me forward.
Any questions or comments? People can relate where you are too, to perhaps, you know, how it could pertain to all of it, for everyone. One of the things I was hearing is, one is focusing on the topic, but then it seems to me another thing that can be challenging, because some of the people had said that maybe they started too big, because you always identify, not all, you identify very important problems, and then I think a challenge is how do you funnel it down to something that is doable? And I don't know if people could any add, or if some of you maybe have our experience in that and have come up with some thoughts, or even just things to think about so it doesn't become overwhelming. But I wonder about that oftentimes, how people did manage to find that balance, that this is something that's feasible for me and is appropriate for a dissertation.
Yeah, and for me, that was the decision to make it strictly a qualitative study. I was really wondering if I should do mixed methods, but well, for one, I wasn't sure whether I would be able to accurately measure what I was looking for quantitatively with the refugee population. But then, you know, I still thought I would probably make it a little bit more marketable to have a quantitative measure, but then I decided to really limit it to qualitative, and that made it more manageable for me.
Sorry, can I interrupt? Did you have any problems in defense of your thesis in justifying making it strictly qualitative? Because I'm considering the same thing.
Not really, because the topic just lent itself so much to the experience, just learning about the experiences. And I wasn't really about making it generalizable to the population, but just learning about the experiences of those who I had studied.
I can also say that when I got some feedback from my committee members on the grandness of what I had decided I wanted to do, and they basically just told me, no, you can't do this. What it allowed me to do was look at where I'm going to in the future. Rebecca said your dissertation doesn't have to be your life's research. I intended for mine to be. So I tried to kind of narrow down the grand project to be the end goal, like the 5-year plan. And in order to get funding for that, like a bigger NIH grant, what would I have to do to have the groundwork laid? And so I kind of cut out some of I did a mixed methods study, but I had intended to do like 4 different quantitative measurements plus phenomenological interviews with people with acute schizophrenia. So it was a bit big. So just being able to say, okay, this is what I'm going to get to. Now, what can I do now to lay the groundwork, get small grants here, and then repropose in a couple of years when I'm ready to get to that space. So thinking about what is the minimum that funders are going to look at to make sure that you've already taken care of, so that that step is kind of checked off the list, and then they'll be more likely to fund in the future. If you do know what your like future research is going to look like, if you already know what your topic or your passion is, then you can go in that direction.
Can I just ask you a question, because I think this is what you said. So did you do a feasibility study and or pilot study as your?
I did a mixed methods feasibility study.
As your dissertation work?
Correct.
Okay.
Yeah.
So I'm thinking about that funding question, and I'm wondering if anyone can speak to shaping your dissertation research based on already existing funding initiatives. So even if it's focused on your area of interest, was anybody looking at what's already out there being like, you know, call for proposal kind of initiative in order to shape your dissertation?
I could say that the research I'm doing right now is actually the extension of what I did for my PhD project. It happened to be that chronic pain is a high priority topic that NIH is focusing on right now, but back then I wasn't like really aware of that. It was just like my really personal interest, but it would be wise if you already are thinking ahead that this is the area that I want to focus on, and also it is a priority recognized by either national or international or local organizations. That would be a really smart way to go. And so I was able to, when I was writing my NIH grant, use my dissertation study result as a pilot data. So that really helped me. I also wanted to kind of go back, and what I thought was really important was forming my dissertation committee really strategically. So if you have this research question and idea and design already kind of planned out, then really strategically looking for the subject matter expert who can help you with the exact area of the project that you will need, either methods specialist or you know, someone who has expertise in the topic or the population, and someone who can really practically help you throughout the process. And for example, for me, I was using, I actually had to develop my own research design that has not existed before. So I had this mixed method research specialist as one of the committee members, and he was so generous that I would even like Friday evening, like 7 p.m. I'll call him and he'll just give me like one-on-one, like 2-hour lecture over the phone, just really walking me through. And I also had another committee member over at main campus in information science with grounded theory method. I would just make a visit regularly and really sit down with her. It was really like private lessons that she was so generous to provide. But now as myself as a faculty, I would be really happy to, like, if anyone like needs feedback or input in developing, you know, their process, I'll be really happy to do that. So I think most of our faculty members are really open and willing to do, and it's just a matter of you reaching out to them. And, you know, I think it was just like my enthusiasm and passion that I really like, you know, wanted to work with you and learn from you. And they're really generous enough to spare their time to sit with me and help me with those in the way whenever you have like really practical questions or more general guides, they really were able to help me throughout. So I think that's also a very important piece. You know, sometimes you find this like big name people who are never available. I think you really need to think about who you need and what kind of help you need for your dissertation project.
I'll add to that. I agree 100%. I came into a study that was already funded and already had aims and was already underway. So I had to develop kind of my own thoughts and figure out how I wanted to develop my own aims. And with that, I was analyzing basically thousands of inputs from about 700, 800 students over a time, like a large time, over 3 years. And I was able to partner with Dr. Shavokis to really hone my skills as a statistician. And I basically took a year and did an independent study to learn how to do like linear mixed modeling and like higher level statistics. So I developed basically new skills based on the limitations of already having a study underway. And that actually has been helpful in kind of boosting my own CV because I have these new tangible skills that are helpful beyond just I have a PhD. So I think finding someone that you can like go to for advice and learn a new skill and develop your own ideas is really helpful. And that's kind of been helpful through my postdoc and hopefully moving forward.
I think that's Abby, following on you, I think you raise an interesting point, and that is all of the programs have core courses and many with interprofessional, they're similar, but then what are the skills and what are the knowledge needs you need for your particular project? I wonder if sort of Abby, if others have experienced or those of you in process are undertaking, here's a knowledge need I have that is not addressed or it's goes beyond a core course, but that it's needed. One, personally, it's providing me a knowledge base and it'll enable me to do my work. So I didn't know if, I think that's interesting. It's sort of your independent learning.
So I also used one of my committee members to gain extra knowledge that I was interested in that wasn't offered here. And I think it's important not to lose sight of everything else in your life and your career trajectory when you're in the dissertation because it becomes engulfing. And so because I worked with one of my committee members, which I incorporated into my dissertation, but because I worked with her and I traveled to New York and did like 100 hours of extra study with her independently, which you can also, if you need an independent study or you have the opportunity to do an independent elective, you can use that and kind of write a proposal for it so that it counts towards your education. But because of that, it's opening up a lot more opportunities for me now that I've graduated. So I've been invited to co-teach with this woman in Montreal over the summer on this topic because there's so few of us that know about it. And I think that when you pick your committee members and when you try and think about what other knowledge will be helpful for your dissertation, also think about what other knowledge will be helpful for your career and how you want to incorporate that into being able to put it on your CV and being able to, you know, teach it or present on it as well, because those things will also all fall into line once you graduate so that you didn't just kind of get overwhelmed by dissertation for however long it takes you, but you've actually acquired all these extra skills that you can use in other ways for your career.
I would also add to that, not to really be afraid to ask people or email people outside of your committee or of the college or people that you see on everyday basis. Because you might be sometimes surprised how willing to help and to answer your questions people from other places, other universities, other countries might be. If they're expert on the topic, if they see something interesting in your work, that might bring a lot of collaboration in the future. And I would just say, like, don't be afraid to put on those tons of emails out there if you have any questions. Even though if that name sounds, you know, this person will never get back to me, you might be surprised that they actually would.
Everyone's aware at a PhD level, and you're working with your advisor in a small group, the importance of communication and sort of thinking it too as it's a little different than when you move along and you're truly a team, but also your committee and your advisor you're in an educational setting. So not to be too long-winded, I'm wondering how, if people had any things to suggest as how you formed your relationships, or how you were able to bring forward, to be proactive perhaps, and bring forward suggestions that you weren't necessarily sure how your committee or your advisor would react.
So for me, I ended up doing this really ambitious project of mixed methods grounded theory study, which ended up with like almost 400-page dissertation. So when I first presented this idea to my advisor, it really required the trust in both parties, that she has to believe that I am really determined to do this, and that she also promised that as long as you're committed, I'll work with you, and we'll do this together. And we really established the regular meetings, and what was really helpful was really creating this timeline for every stage, and try to really stick to that timeline. And she was really good at kind of checking in with those timelines. Without that, I don't think I could have finished even in that period of time. So really setting up the realistic time goals, and that helps both you and your advisor. And when you have, of course, deadline, you become more productive. So really setting up the realistic deadline so that you don't feel like you're constantly failing or behind, and achievable goals, small goals, can be really helpful.
Can you elaborate a little bit more about how to construct an accurate or realistic timeline like you're talking about?
So it could be as simple as really coming up with a clear research question or a hypothesis, or by end of this month, I will finish at least half of introduction section, or come up with the name of this design, or finish this IRB application. So really detailed, big, long-term and short-term goals. And we had this like big kind of like table with big goals and like small goals, and with all these like detailed dates, and meeting regularly to check in whether I have met that goal was really helpful.
At what point in your doctoral career did you construct that timeline?
I think it was after my initial proposal. Yeah, so when we were really beginning to like, okay, now we're starting this, and in the middle, you sometimes have to adjust the timeline depending on your IRB's approval, or there can be some expected things happening to recruitment and everything. Always there are surprises, so you may need to modify in the middle. But having the overall like timeline can be helpful.
Thank you.
If I may jump in, that was always my question also as a student, and it still is. Constructing a realistic timeline is an ongoing work for me. What I found worked best with collecting data was that I had a little calendar where I marked off each week how many participants I collected. And from that, I could kind of gauge how much time it would take me to finish data collection. And so that's what I noticed. If you can track your progress as you go along, you may have a better idea of, oh, all right, so it took me this long to finalize the introduction, to finalize the pre-proposal. Like maybe it'll take me this long to finish the discussion. Collecting data on yourself as you go along might help make a realistic timeline.
Another thing, another concept that helped me in terms of timeline is that I can't remember who said this to me, but Minjung, you never finish your dissertation. You just stop at some point. You have to stop. So I can like forever perfect my dissertation, right? And I heard about this instructor. She said after it's been 10 years, she has finished her PhD. She still goes back to her Word file and make corrections. you can do that, I guess, later. But it's like, you know, even though you're not completely happy and satisfied with your work, just knowing, okay, this is time to stop, and you can, you know, revise things when you publish, you know, new manuscript, and so that just concept of, okay, I just stop and not finish this helped me.
So exactly what you're saying is kind of mirroring an article that my advisor had shared with me called The Good Enough Dissertation. Are any of you familiar with that?
No.
No? They're basically saying, yes, eventually you kind of just have to stop and say this is good enough to meet the goal of graduation. And I wasn't sure if people give that article any credence, if it's worth adhering to, but it sounds like it is.
Would you be willing to share it?
Of course.
They email it to me, and then people, we can put it on like the PhD and the postdoc
Absolutely.
Blackboard shell. It's always good to get those kinds of perspective articles.
Yeah, I wanted to add to that too, that kind of like that balance between having the vision and like the long-term view and being in the moment and kind of doing what's in front of you was really helpful for me, like going back and forth between those two, because sometimes you lose sight of what you're really trying to do because it's so much in the moment. So it's like pulling yourself out of this craziness of the moment and just in the long run, this is what I want to do. But then also, you know, really bringing yourself into the moment. And I think the beauty of this whole process for me was that each part was so different, and the skills that I had to have for each part of the dissertation was so different that I almost, I almost want to just sort of encourage you to sink into each part and do that really fully, because you learn so much in it. That makes sense. I think that's very unique. I don't think, you know, like, I think later on, I feel like whatever I'm doing now it's not ever going to be at the same, or it might, but for now it seems like it's not going to be at the same depth. You know, you really will never know something as well as you did when you did your dissertation. So just really go into, you know, whether it's the data collection, really collect the data fully, you know, and be in that. And, or if it's the introduction, really get all the information that you can and really know your topic so well. And then the method, you know, really know your method. So I just appreciated that so much, that I could learn so much about each part of it. But then again, you know, with the timelines often not working out, just not to be discouraged and just to be patient. And just know that, like you said, at some point it's just done, and it will be done.
Yeah.
How did you deal with the uncertainty and pressure of the data collection period?
Maybe I can speak to that too, because I had about 6 months where I only had two participants. And recruitment was so difficult for me. And I think you just have to trust in the process, and trust that there's a reason why it's going slowly. Maybe make adjustments. For me, I had to then go to different sites and look for different recruitment places. And I had to go from 1 to 3. But just don't be discouraged. Just know that it will get done at some point. It might not be in the time that you want it to, but it will get done.
So with that said, and following up on what Rebecca, you were saying, and the timeline, or the schedule for your tasks, I think the very important thing is to be flexible and not to feel really bumped out when you're getting outside of your timeline. So you are flexible enough to adjust it based on what is happening. And I've been experiencing this myself, that I had to adjust my timeline and my short-term and long-term goals. And many of my colleagues during their dissertations also had to do it based on factors that you really can't foresee unless, you can't foresee them before. They're just happening, and it's the nature of the research.
I think if you come across difficulty during the time, it is also the important information that means that whatever timeline you had was not feasible, right? And also admitting that even when you publish, you might have to adjust, like modify your goal and saying that because of these reasons and this was not feasible, and then how can you come up with a strategy to really make it work better, or just analyzing some of the factors that might have contributed to that, that problem that you came across. So I wouldn't just be discouraged and stop, or just take I don't know 2 more years, but that is an important information that can be useful for someone else. In this condition, it is just not feasible, or it takes much longer than you have first planned.
Also, you need to, because it does get very discouraging when you have no recruitment, but I actually started looking at that as downtime. So I was like, oh, I have downtime. So in that time, I went back and, rewrote other sections, or I made a new timeline, or I did some self-care, or I said, oh, no recruitments, I'm gonna just sit and have a cup of coffee, right? So I think if you use that time wisely, even though you don't think you're making progress according to your timeline, you have to really remember to stay motivated to do something else and fill that time and just say, okay, I have been looking for time to rewrite this section for so long and I have no new recruitments, so today's the day. And then you just kind of give yourself time to move away from it. But ultimately, there are many, many humans that have done it. So it'll happen, right? And you have to keep telling yourself that too. Like, I would go to the hospital and there would be no recruitments for a week, and I would panic and say, I'm never getting this done. And then the next week I would have so many new people in the study. It balances out. But it's time to do something else that you would not have had you been collecting those data.
I can just comment on recruitment, if that's okay. Can everyone hear me? Okay. I mean, just from my dissertation and from other studies that I've done, I always had to get permission from a legal representative instead of the actual person who was going to be in the study. So a lot of times I know that the legal representatives are working during the day, or, this might not seem like something that's really important. So I've found that following up more than one time, maybe even up to 3 times, it was really helpful and maybe even changing or writing a script before you call, if that's part of your protocol. And if that script doesn't work, maybe changing it to something else. And even just, I think the one thing that did help was if someone was participating in the study and they're saying, oh, this is so good, I'm so glad I did this, I would ask them to say, well, if you know anyone else who's interested, please let them know about the study. And that always was how I was able to get my participants, was just by word of mouth, and really trying to make sure that the people who were in the study were getting, having the best experience that that I could offer. But I wanted to go back to the relationship. I know that that was brought up in communication with committee members. I commuted from New York to Pennsylvania during, the time that I was at Drexel. So I had to really think about, for my dissertation, who on my committee who on my committee would be from Drexel, and then if there was someone who in New York, maybe I would want to work with in the future, should possibly be on my committee as well. And I'm really happy that I did that, because once you work with someone and people see the quality of work that you're doing on your dissertation, it opens up opportunities, or it might open up opportunities in the future, for you after you've completed your dissertation. And that's really how I was able to get a couple of the positions that I'm currently working on. So I just wanted to, remind you to try to have a good relationship with your professors, and also people are, consider people who on your committee might be helpful for you in the future with your career.
I think one of the hardest thing when you're working on dissertations, when you're feeling like you're all by yourself doing this, alone. So really, it takes a village to like build the dissertation work. And I think one way that helped me to make my committee members really engaged is that I sent regular email updates to all my committee members that what I have accomplished and what I'm planning to do in the next, quarter or so that they're really keeping updated with my progress, and they may provide some, input or feedback or encouragement as I need it. So I think that was also another thing I would recommend you doing, either quarterly, this email, and then so that I feel like when I was defending my dissertation, all the committee members, even though they didn't really know each other, they were kind of there was a sense of that team amongst the committee members, and then we really are doing this together. And of course, like also the peer support is very important, and really the self-care, like while you're working on dissertation, also your health and relationship, a lot of things can be like threatened, so really always to make sure you're centering yourself and taking care of yourself is also very important.
I'm going to bundle a couple of questions into one, if that's okay. First part of the question, has anybody here changed academic advisors or faculty advisors throughout the course of their PhD? If so, like, was that volitional or out of necessity because they like left the institution? And how did, if at all, did that change the trajectory of your study or research?
Was that all of them?
That's it. Promise. Thank you.
Yes. So my academic advisor, my PI, and I had an amazing working relationship, and I truly felt like she was my partner through the entire process. And then 3 years in, she left Drexel. And so that was really disruptive to me. I found out she was leaving the same day I found out that my IRB was getting sent to full review and that I would have to go defend that. And it was really overwhelming. And my transition was really rough because my new advisor worked very differently than my old advisor. And so I had to make a lot of adjustments with my expectations. I think it was good because I basically kind of said to my new advisor, like, I'm just going to take it and run. Are you okay with that? Whereas my old advisor was really invested and kind of like literally I would email my advisor and within, I would imagine at most 45 seconds, I would get a response from her. So she was very involved. My new advisor, it would be like, sometimes you have to email 6 or 7 times over the course of however long before you get a response. So I think it just taught me that I needed to be available to be flexible with how I'm receiving support. And then it really pushed me to just do everything at that point. Like that final year of my work, I basically just did as much of it as I could on my own, and then reached out to my team when needed. But it was rough. It was intense. It was very sad. But it worked out, and yeah, I don't necessarily encourage changing your advisor, but if you need to, then it can work out. You just have to really I would suggest, if this happens to anybody, to sit with your new advisor and just really talk about their communication style and their advising style, and really kind of reset your own parameters, reset your timeline, reset how you're going to connect with that person and what role they're going to now play, and not expect that it's going to be a comparable role to your last advisor.
Thank you.
What is your advice in order to prepare ourselves before the final defense?
I'm sorry, I didn't get the question.
What is their advice in order to prepare ourselves for final defense?
Defense of your actual dissertation.
Yeah, that's right. Yeah.
How to best prepare for your dissertation defense.
Well, one thing is to really time it.
Yes.
Make sure you are, was it 25 or
30 minutes.
30 minutes? Don't go longer. Really, really have the timing down so then you can feel confident.
And I would make sure that, because it will vary a little bit by program, so make sure you know exactly what the format is for your program.
I think at that point, you know your research. And at that point, you probably know your research as an entity better than any one committee member does. And so you just have to remind yourself that now at that point of defense, you are actually the expert in the room on your own research. Everybody might have expertise in a particular area, but you know the whole of it better than anybody else in that room. And if you remember that, then it's just this lovely opportunity to piece together all of your committee members and inform them of how each of them contributed and what you did with that knowledge. I mean, we're all dance therapists, so I have a background in dance, so I did dress rehearsals like every single night to make sure that my timing was right, and to make sure that I knew exactly what I was talking about in a really concise and articulate way.
I think we're just about out of time. Join me though in thanking all of our alumni. Pretty impressive and exciting, all the things they're doing and how they'll be contributing in the years to come as they're all launching their careers. So thanks so much, everyone. And my guess is any of them would probably be more than happy to respond to a question you might have regarding the dissertation process. So thanks, everyone.
Yeah, but if you have a question that you want to get to somebody who